All right, so when you're doing an ankle eval, the first thing you want to do is compare bilaterally. This way you're checking for any sort of swelling, any discoloration, deformity, ecchymosis, any abnormalities you might find. You're also looking for any sort of discrepancy with arch. You're going to want to look at the athlete's feet, or shoes too, rather, to see if there's any sort of like abnormal walking patterns they might have. So when you start the evaluation, first thing you want to do is just look around, see if you see any swelling, any deformities, any ecchymosis. Then you're going to move into palpations. You're going to want to start off at the tibial tuberosity, and you're going to want to make sure that you're palpating with a purpose. You don't just want to kind of softly, gently go down the leg. You're going to actually want to squeeze. You're going to move. You want to feel for any sort of bony deformities, anything that feels kind of swollen. And as you make your way down, you're going to want to start evaluating the ankle itself. So on the medial side of the ankle, you're going to want to look at the medial malleolus. Just below it, you're going to look at the deltoid ligament. And just above it over here, you're going to be looking at the tibialis anterior tendon. On the lateral side, you're going to be looking at the lateral malleolus, the posterior talofibular ligament. Just below it, below the lateral malleolus, is the calcaneofibular ligament. Just in the front is the anterior talofibular ligament. You're going to want to palpate the sinus tarsi as well. That's right in here. This is where you're going to find a lot of swelling too if there's a lateral ankle sprain. You're also going to want to take a look at the fifth metatarsal too, just at the base. This is where a lot of injuries happen. There's a lot of swelling during foot and ankle injuries. So the next thing you're going to want to test is the athlete's range of motion. So first you're going to want to test active range of motion. So the first thing you want to do is have them work on themselves. That's the active range of motion. So you're going to want to test their dorsiflexion. So you're going to have the athlete point their toes up. All right, then plantar flexion, have them point their toes down. Inversion, point their toes in. Eversion, point their toes out. Okay, then the next thing you're going to want to do is the passive range of motion. They're going to do the same motions, but you're going to do it for them. So you're just going to want to have a nice grip just in the bottom of the leg, just for stability. I'm going to test the dorsiflexion. All right, plantar flexion. Inversion. And eversion. All right, the next thing you're going to test is resistive range of motion. All right, they're just going to go through the motions with me resisting. All right, so going to dorsiflexion. All right, and plantar flexion. All right, inversion. All right, and eversion. All right, very good. All right, you're going to want to do some manual muscle testing. So what you're going to want to do is give them a position, have their foot at in a neutral position. And you're going to have them not break you out of this position. So I want you to hold this while I pull down. All right, and hold this position as I push up. All right, hold as I push in. And as I push out. All right, so you're going to want to move into special tests. First thing you do is Taylor tilt test. This will help you see any sort of laxity that they have in the lateral ankle with the ATF, PTF, and the CF ligaments. So you're just going to have a grip on just in the calcaneus. You're going to move the foot into inversion. You test for any laxity there. All right, another test you can do is anterior jaw test. You're going to grasp the calcaneus again. You're going to pull forward, anteriorly. And you're testing for laxity in the ATF ligament. Another test you can do is a squeeze test. So you want to start distally, squeeze, move your way up the tibia and fibula. What you're doing here is testing for a stress fracture. Another test you can do is the Thompson test. So what you do there is you squeeze the calf, and what you're looking for is plantar flexion. And if you don't see any plantar flexion, that's a negative sign of the test. That's indicative of an Achilles tendon tear. You can also do this test with athlete's leg bent at 90 degrees. So next you want to move on to functional testing.